422 million people worldwide have diabetes. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar. This disease is one of the major causes of blindness, kidney failure, heart attacks, stroke, and low limb amputation. In this video, I will briefly explain what insulin resistance is, what types of diabetes are. At the end of the video, I will give you reference values that are measured in diabetes and insulin resistance. Insulin resistance. Before moving on to insulin resistance, we need to understand what insulin is. Insulin is a hormone of a protein nature. Its main action is the utilization of glucose in the body. Insulin is produced in the beta cells of the pancreas. If the beta cells of the pancreas are damaged or do not produce enough insulin, this leads to an absolute insulin deficiency, a characteristic feature of type 1 diabetes. In type 2 diabetes, insulin is produced in normal or even increased amounts, relative insulin deficiency, but the mechanism of interaction of insulin with the cells of the body is disrupted. This is called insulin resistance. Insulin resistance is defined when normal or elevated insulin levels cause an impaired biological response, that is, impaired sensitivity to glucose utilization. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Type 1 diabetes. There are two main types of diabetes mellitus, type 1 and type 2. These types of diabetes are polygenic, meaning they are related to a change or defect in multiple genes. Type 1 diabetes, previously known as insulin-dependent, juvenile, or childhood onset, is characterized by deficient insulin production due to damage to the beta cells of the pancreas. The reasons for damage or massive death of beta cells can be as follows: autoimmune destruction of the beta cells of the pancreas, pancreatitis, that is inflammation of the pancreatic tissue, toxic lesions of the pancreas, stress conditions, oncological diseases, genetic disorders. Type 1 diabetes usually manifests itself in childhood and adolescence, more often in people younger than 30 years old. However, this form of diabetes also occurs in adults. Some cases of type 1 diabetes do not appear to be autoimmune and are considered idiopathic. An idiopathic disease is a disease the cause of which is not established, or it's not beneficial for someone to have it established. Factors such as high levels of nitrates in water and food, vitamin D deficiency, and cow's milk consumption may play a great role in the development of type 1 diabetes. There are already two detailed videos on my channel about vitamin D deficiency and how to eliminate it. Links below this video. And there is a lot of interesting research on the relationship between cow's milk and diabetes. There is a significant positive correlation between consumption of unfermented milk protein and incidence of type 1 diabetes in data from various countries. Early cow's milk exposure may be an important determinant of subsequent type 1 diabetes and may increase the risk about 1.5 times. Have you heard about this? Do you consume milk or dairy products on a daily basis? Let me know in the comments. Type 2 diabetes. Type 2 diabetes, formerly called non-insulin dependent or adult onset, results from the body's ineffective use of insulin. In type 2 diabetes, there is an accelerated inactivation of insulin or specific destruction of insulin receptors. These receptors are located on the membranes of insulin-dependent cells in the liver, muscle, and adipose tissue. Risk factors for type 2 diabetes are obesity, chronic overeating, a sedentary lifestyle, old age, smoking, alcohol consumption, arterial hypertension. Overall, this type of diabetes most commonly affects people over 40. In type 2 diabetes, there is often a violation of the circadian rhythms of insulin synthesis. Circadian rhythm is associated with the change of day and night. A genetic predisposition to type 2 diabetes has been proven. Other types of diabetes. Rare forms of diabetes result from mutations or changes in a single gene and are called monogenic. These are neonatal diabetes mellitus, maturity onset diabetes of the young, and other genetic defects. Also distinguish separately ladder diabetes, latent autoimmune diabetes in adults, and gestational diabetes, type 1 and type 2 diabetes diagnosed before pregnancy and diabetes diagnosed during pregnancy. Diagnostics. There are several ways to measure insulin resistance. One of the most convenient and frequently used is homeostasis model assessment. An insulin resistance score, HOMA-IR, is usually computed with the formula fasting plasma glucose times fasting serum insulin divided by 22.5. The normal level of the HOMA-IR for persons from 20 to 60 years old is from 0 to 2.7. Low HOMA-IR values indicate high insulin sensitivity, whereas high HOMA-IR values indicate low insulin sensitivity, insulin resistance. Reference ranges of insulin, glucose, and glycosylated hemoglobin at the end of this video. That's all for today. Next time I will share with you 2 medications to lower high blood sugar and insulin. Take care of your body, mind, insulin, and glucose levels.